meeting is going to be live on our Facebook page for those of our members who are unable to make it here. Naturally, you are aware that there are restrictions on the numbers we can accommodate, and because of that, we had to live stream this event. So for those of you who are watching us online, please comment at the bottom of the videos, and we shall be tracking those questions and providing answers to them. The program, as we have it, we are running slightly behind schedule because the first bit was supposed to be at 10 a.m., but we were slightly delayed. We shall have welcome remarks from the chairman of the Uganda Manufacturers Association. Then we shall have a presentation from KPMG, and they'll be telling us about what we need to do to protect our businesses. This discussion is going to be presented by Benson. Benson is here from KPMG. KPMG are also our auditors, so we reached out to them and they've been gracious enough to share their knowledge. We shall then have a presentation on mitigating COVID-19 at the workplace. This is looking at the more health-related aspects of what you need to do within your workplace. And then we shall come to a way forward, and we shall then close the first part of the meeting. There's a follow-on session where we shall have a discussion with those of you who are in specific sectors that we talked to on what we can do with you to improve supplies of some items to the country. Without much further ado, I would like to welcome the chairman of the Uganda Manufacturers Association to talk to you. Thank you.
Yes, good morning, ladies and gentlemen. We are indeed in very trying and different times. We don't know what's going on in the future. And for that reason, we thought that as manufacturers, there are things that are particularly unique to us that we needed to talk about and discuss. This is not by any means the last. It is going to be one of many discussions that we're going to hold with our members. As the ED has told you, we had thought that we were going to have a big turnout, but with the situation as it is, we had to cut down the numbers, and we're depending, as probably a lot of us will do in the future, on modern technology. So we're using Facebook at the moment to stream this, as he said, and we're looking to get a YouTube channel for Uganda Manufacturers Association, which is going to take us through this particular time. Now, as the UMA, we have been invited to a lot of forum. We have been talking to a lot of people. And after this discussion, we are going to take a lot of the discussions that we have here to the Prime Minister and feed it into the Ministry of Health. And there are other initiatives within the private sector that has been started off that we're going to be a part of, and we're going to feed into. All of it, really, it's about partnership. I think more than ever, this event has shown us that it is not individual success. It has to be partnerships that we're going to get through it. As UMA, we have some recommendations, but I think I will hold on to discussing this and really hear what KPMG has for us, what they have suggested for us, and then we can talk about some other issues that, as UMA, we are thinking of. So, Benson, you're welcome.
Okay, I think you can hear me now. Good morning, everyone. And thank you, the Chair, for inviting us to share our thoughts in this difficult time, especially for business, but also for individuals, because everyone is really alarmed. We've never seen something like this, or through the literature that we read, this is something that really has gone beyond, and it's global. What I have here is really, our presentation is structured into two sessions. One is really to show you a glimpse of the global impact, and then we bring it down to regional. What is the economic impact at the regional level? And then we shall touch base on what companies should start planning to do. As we can see, within East Africa, I think we've had reported cases. At the moment, Rwanda, as the time I prepared this, there were 11 cases reported in Rwanda. Thankfully, no death yet, but our neighbors in Kenya had 7 cases. Ethiopia had 3, and Tanzania had 3 cases reported. We're still lucky in Uganda and Burundi. We haven't reported any case, but that doesn't mean that we're not feeling the impact. If you look at the global arena, as of yesterday, based on the World Health Organization situation report, there are about 839 cases reported, and 8,778 deaths. Now, if you look at Italy now, this morning I was checking on CNN, it has overtaken China in terms of casualties. In fact, they were saying every 10 minutes, so if you spend 10 minutes here, that is one person dying of this disease. So it's really serious, and they are locking down the entire country, so to try to contain the pandemic or the spread of the virus. If you come down to Africa, as of yesterday, there were 367 cases and 7 deaths. So this is really a worrying situation for individuals, for the population, but also for the business. Now, what does this mean then? Before I talk about what it means for business, what you're seeing on the screen there is the projection before this disease spread out or broke out. We're projecting, global economy was projected to grow beyond 3, okay? And if you look at if you look at the world growth, it was projected to go beyond around 2.7. And then if you come to Sub-Saharan Africa or least developed countries, it was projected to go beyond 5.5. Now, these were the heydays. And then fast forward to December 2019 and the first quarter in 2020, according to Moody's projections, they are saying if this coronavirus disease creates a recession, global growth is going to contract. It's going to contract by 0.1. That's where we have the circle there. And they have also projected the impact on a quarter-by-quarter basis, including key states like the US and China and other zones. Unfortunately, there was no projection for Africa. And I think we must know that it's very difficult to estimate the impact of coronavirus. But as always, Africa comes last or lags behind. So we hope there will be some estimates made to see what the impact will be. But in a ballpark, the global growth is going to tank. In fact, Bloomberg is projecting that this disease could cost the economy 2.7 trillion lost output. Now, I think those who still remember the impact of the financial crisis, I don't know if we came to this level. So this is really a tough situation. Let's now come to the regional regional aspect. East Africa, the upper curve, was projected to grow above around 6.2. That was before the outbreak. Now, since I said that we don't have projections for Africa yet, or later on East Africa, I tried to kind of do a trend analysis to see how has Uganda performed in previous situations when there's a global issue. If you look at the curve on my extreme right, during the financial crisis of 2008, when the global growth was going down, Uganda's growth was also going down. So our growth is hugely impacted by things that are happening in the world. And it's in tandem with things that are happening globally. So even if we don't have the projections yet, expect this. In fact, I'm sure if I ask all of you here, you may be already feeling this. Some of your raw materials could be stuck somewhere. So this is what it's going to mean for our economy. In fact, yesterday when the Minister of Finance was giving a briefing, there were projections that 780,000 people could be pushed to poverty. Imports are expected to decline by 44% in the last 4 months of this financial year. Revenue corrections, there are going to be additional revenue correction shortfalls of 82.4 billion in the current financial year and 187 in the next financial year. Now, we all know that here government is the biggest spender. So if they are not able to correct what they want to correct, they are not going to spend. And what does that mean for business? That is lost business. Our sales are likely to be hit because of reduced activity by government, since they are not collecting enough. So these are already some of the impacts that we need to reflect as you do your contingency plans in this period. Now, and because of all this, I'm sure if I was to put the list of countries that have imposed travel restrictions, it could be so many slides here. Each country is restricting travel within, coming in or going out, even within the region here, including our neighbors in Rwanda. Business closure, shutdown. I think even here the president has already directed partial shutdown for some businesses. If you have schools, kids today is the last day. Now in other economies, they are totally locking down the economy. You can imagine people used to say that New York is a city which never sleeps. But as we speak, it's on total shutdown. California, 65 million people have been told stay at home, do not move out. Italy, the whole country, in fact it's not states or cities, is locking down the whole country because the cases are really skyrocketing. Now, social distancing. We're being told to work from home, avoid social events. Or if you attend some, ensure, whom I think is ahead of the game, I can see they're really taking the guidelines seriously. You can't even come close to anyone. The sterilizers, When I was coming in this morning, my temperature was a bit high, so the health practitioner outside measured and it was reading 37.1, and he was really hesitant. He wanted to bounce me off. Then I said, but the sun is hitting me. So I went outside again, and he measured and it read 28, and he said, okay, now I was actually coming for you because I wanted to know. So that's how serious it is, but I'm glad you have these measures when we're having such events to make sure that the situation is minimized or contained. Now, social distancing, people are reducing trips to markets. They are not traveling, okay? They're not going out to eat out or to happen at night, you know. Other social events have been cancelled. So all these actions are affecting all the sectors of the economy, all the sectors. But of course, tourism is heavily hit, especially in this region, in fact, all over the world, because people are not traveling. So people who are running hotels, or if you're producing products for the hotels, there's going to be a trickle-down impact. In fact, yesterday the minister was saying tourism earnings are going to decline significantly. Now, if you look at the last reported numbers, Uganda as a country earned over $1.6 million from tourism. Now, if we are not allowing people to come in, that means all this revenue is at risk. Now, this is just a fraction of the entire tourism, because this is what government is tracking. What about people who are employed to support these tourists? So these are the implications for businesses, for people, for governments, all stakeholders. And of course, all this impact really translates into reduced income, looking at it from both supply side and demand side. From the supply side, we're going to have reduced production. I'm sure you know this better than me, because you're entrepreneurs, you're manufacturers, you know the situation on the ground. If you can't get your raw materials from China, how are you going to produce? If people are being told to stay home, how are you going to produce? Or even if you produce them, how are you going to move them if you don't have the people? I'm not saying this to scare or amplify the message, but that's the reality that we have at the moment. Now, of course, with that, it means that there's essential goods. If you're producing essential goods, the prices are going to skyrocket, because production has reduced and everyone is looking for that same good. I think here in Uganda, the cost of sanitizers, if you compare the cost before this outbreak and now, you already see a huge increase. I was shocked to read in the US, supermarkets they are running out of stock for toilet paper. It's now a key item. Ventilators in the healthcare, they are not enough. Hospitals are running out of supplies to equip the medical staff that are caring for the patients. So, for some sectors, prices are going to skyrocket to kind of acquire the essential goods. On the flip side, if you're producing non-essential goods, in fact, you should turn off the lights, because people now are looking at survival. I don't think I would go out and now start shopping for clothing or shoes when I don't have food for the next month. Do you think I would do that? So any business that is not producing essential goods, I think part of your contingency plan is to turn off the lights, at least first exhaust the stock that you have, or the inventory that you have. From the demand side, obviously, because of the shutdown, people are being laid off in some countries. They are starting to negotiate reduced pay. So that means consumers have limited income. They do not have capacity to consume as much as they would have wanted or they have been consuming. So definitely this is going to impact on sales for manufacturers. sales are going to go down, especially for the non-essential goods, because people do not have money. We've had 780,000 people could be pushed to poverty. These are people who are earning something, but now, if the shutdowns continue, the entire tourism is down, hotel is down, schools are shutting down, and these are our customers that should be purchasing your goods. So reduced demand it's no longer, is it likely to happen? It's when is it happening? That's the question now. And all this is going to hurt businesses and employees. On my right is a chart I just tried to show our top trade partners. Obviously, Uganda is a net importer. In fact, most of our raw materials, I presume, you could find maybe we import about more than 50% of the raw materials that we use to produce goods that we sell on the local market. So, China and India, our biggest import destinations, they are locking down production, or it's just recovering. I think as of yesterday, China reported a 0 local case. In other words, they didn't have any case reported other than people who are coming back from other regions, which is good. So probably the situation is improving and production could resume. But how are you going to get your good here? We've had mainly airlines are shutting down, being grounded. I don't know from the shipping line what is happening, but I presume you have contacts and you're already getting updates to make necessary arrangements. So as a net importer, this pandemic is going to have a huge impact on Africa. If these conditions remain, if restrictions remain, if business shutdown remains, Africa will be left in the cold because we heavily depend on imports to add value or to produce our goods. And this even goes beyond goods. Governments now are focusing on their people. Money that is coming through to finance development projects is going to be reallocated. I think you've heard the US, the White House is proposing a $1 trillion tariff to family relief. They are planning to give money to families that are affected. Now, it means that if there were some investments or money that was supposed to be channeled through USAID to support us, that is likely going to be reallocated, further hitting on the demand. So investors, I don't think there's any investor now who's saying, where do I put the money? Everyone is waiting, you know? So people who are planning investments in the market here, all those are going to be shelved until the situation normalizes, because no one knows what is going to happen, how long it's going to last, when is it going to clear. So if investments are affected, that is going to affect demand for our goods. It means we shall have fewer people getting jobs, and the fewer the people, if people are not earning, they will not be able to purchase what we're producing. So I guess maybe we should move to the next phase, because we are all tech savvy and we know what's happening in terms of the impact. So let's see what companies should be doing. And again, before I go through, I should mention that these are only guidelines. Okay, these are only guidelines. Each organization should detail their own analysis depending on the specific conditions they are in. So this is just a guideline or a roadmap of what you should do. I mean, you've been in business. I can't come and tell you do X, Y, Z. There's no silver bullet, okay? So I think from our view, the first action really is to protect the employees, because Our employees are the greatest asset for any company. Without them, I don't think you can move your good from the factory line to the market. I know there are people who have automated, but I don't think we have fully reached that level where we don't have any human intervention. So protecting employees is going to be your action number one. And I will take you in detail what specific actions you're going to take on that. And as management or MDs or CEOs, you cannot protect employees on your own. You need to set up teams and assign them specific roles and tasks to help you contain the situation or guide the employees on what to do. Now, the third and fourth action, this is where the finance role is going to be very, very critical. They need to analyze what will be the impact in the worst case scenario. What is the impact if things were favorable? Moderate, not favorable. What is the impact if we remain as we are now in the current conditions? What is the impact if Uganda starts reporting cases? Are we going to see a full shutdown? So you're going to do scenario analysis is going to be very key here. Focusing on your demand forecast in terms of sales. What are you able to sell? Okay. If you're not able to sell, do you need to contain, how do you contain the cost structure that is linked to that sale? Okay. So each scenario will have different outcomes, but at least you'll be aware that if such and such a thing happens, these are the actions I need to take. When do you discuss with the employees to say, look, in any case, I don't have funds to contain you? When do you start those discussions? So the finance function is going to be key to support companies to analyze, to make sure that there's sufficient financial liquidity, and also they stabilize the supply chain. And again, I'll go through in detail to give you hints on some of the actions, specific actions you can do under each of those areas. Number 5 is around customer engagement. We have customers who had placed orders. Okay, in Uganda we don't have a full shutdown, but if it happened, are you able to deliver those orders in time? What impact is it going to have on the customers? Because they also have businesses that are running. So engagement with customers to make sure that you plan, communicate anticipated delays is going to be crucial, because we sign contracts. There are covenants, there are terms that we have to fulfill. You cannot sit here and assume that a customer, every customer knows this. Yes, they know, but some are going to say, you didn't inform me, I didn't know you're facing this challenge. This was the deal. So you need to take it upon yourself to communicate. If there are any delays that you're facing, communicate in time and make sure that both you and the customer are on the same page. Again, here maybe I can bring in the bankers. Some of us have loans. If you're not able to make the money, how are you going to make the repayments? So it's okay, I think, if I put them under customers, because they are offering, or suppliers. So that is an action that you need to assess. And of course, this is specific to each institution. If you find that you don't have these aspects, you don't need to do that. Then lastly, obviously we live in times of calamities like this one. We should not sit on just sit somewhere and just be bystanders. As the chairperson said, we're going to need collaborative efforts. We cannot let our communities just suffer at the hands of this calamity. So if you can, this is the time to support the communities, because really people are feeling the heat. And I think here things like what MTN announced, trying to reduce the costs of data, would really be recommendable. That is, if you have capacity to do that. So again, these are guidelines, but we'll inform you as you formulate your contingency plans. Now, in terms of protecting employees, I'll just highlight a few. I think what is key is, are you providing clear communication? Because there's a lot of information flying around. Some could be misinformation with social media. People are scared, they don't know what's happening. False alerts, you know. So what information are you passing on to your employees? And even their dependents, the people they support. So I believe you're already doing this, but if you're not doing it, this is the time to consider information you can relay. It could be information from the relevant institutions like World Health Organization or Ministry of Health that you make sure is passed on to employees. There's going to be need to set up teams to help you do this. Number one, I'm calling one team should be the nerve center. This is the one that is in charge of coordinating all the communication back and forth. Then employee protection. I think you're going to have a team that is really, if any of your employees is affected, what do? Do they run to the communication, or there's a standby team that is going to help that employee? Financial stress test, I've talked about that. That's the finance team, combining the supply management. They need to do some scenarios to indicate to you what is the likely impact if such and such event happens, or if we reach level 3, what actions should you be taking? So again, on protecting employees, I know some, especially the service firms, service companies, they are now trying to support employees to work from home. For instance, at KPMG, there are arrangements which have been made to make sure that everyone has sufficient data or can access data that you can use in case you want to, if there's a lockdown. Now, for manufacturing, I don't know how that is feasible, because most of the activity happens at the factory. So I don't know. But I think through the scenario analysis, you're going to start analyzing what are the core stuff that I must. Or what products, if you have so many product lines, which ones are really, really needed, and which ones do you want to phase? Okay? But I don't want to go there deeper, because I know you're experts in your businesses. You're able to evaluate which one is really core and which one is not. So employees will be encouraged to work from home, and you need to empower them to have the tools to work from home. And I hope we shall not reach a situation where there is a congestion in the network. I don't know whether, if everyone is online, do we have the infrastructure that can contain that? Okay. Now, in terms of ensuring sufficient liquidity and supply chain management, those who have sufficient cash, at least to contain you in the next 3 months, you're somehow in a better position. If you're not in that capacity, and probably you have some loans with banks, the first thing to know is, once you've assessed the likely impact on your sales and the costs or the impact of that on your profit, you need to engage your bankers. And I think some banks have organized similar events, and they have encouraged their customers to engage them. I was reading DFCU, I think, was recommending that. I think all institutions are trying to see how we support each other, because We don't want to lose any company. So if you do not have some cash cover, please engage your bankers and see what options are available, whether there is going to be a waiver in terms of the repayment or not. Engage your customers, as I mentioned earlier. You know, engage them and see if there are delays that are anticipated. I hope some will not be calling and say refund those who had paid in advance. I want my money back, you know, because you're not able to supply. So there's going to be some communication you need to undertake. And then 3, conducting scenario planning is going to be crucial. You have to undertake scenario planning to understand the implications for your operations from the financial perspective and non-financial. Okay? And here non-financial, we mean there are people who depend on the companies, employees, they're dependents. So as you make the decision of, I'm hoping we don't reach that level of laying off, that there's a financial component, but there's a social element as well. What are these people going to do? You know? So scenario planning is going to be key to ensure that you analyze the impact to your operations. Try to understand how prepared your key suppliers are. Those who are sourcing raw materials locally, try to understand. Of course, we can't predict which states will be locked down, but in some countries, if you know you're sourcing supplies from an area which has been locked down, are you able to source alternatives? Are there alternative options? Or in terms of getting it from other suppliers? Or could you use a different raw material to achieve the same product, to produce the same product? So those are options you have to consider. I guess I've covered much of the content there. Now, this was, what I've just taken you through was the response from individual companies. But what about the government? What are the policymakers doing? Now, by the time we compiled this, the disease had not spread to the US and Europe. So the analysis we have here is really the policy response by Asian countries, which was compiled around Jan, 23rd Jan. And as you can see, there were policies about cutting the lending rates. You know, China was cutting the lending prime rate. There are some subsidies that policymakers are making. I thought when the minister was presenting the brief yesterday, I hope he would talk about something like this. What are they doing? What plans do they have for manufacturers here? Because surely you're not getting your raw materials. Should we expect you to pay the taxes? Or are we expecting some relief? Should the CBR be reduced from 9, maybe to 8? Is there a fund that is really to cater for this situation? And I believe maybe, as the chair mentioned, that from this discussion, probably these are some of the questions you're going to take to the policymakers to see how they can support companies to remain afloat. That's all I had prepared. Thank you for being a good audience.
Benson would like to thank you so much for the information that you've given us. I am sure that all those who are watching us on Facebook can pick something from what you've said because it's very critical. There are areas that you talked about, and I think the big one was about basically, it's around how do you secure our cash flow. Whether you call it liquidity, but it's really about cash flow. And I guess that's, as manufacturers, that's what we have been looking at, and how is it that we can secure it. And you also mentioned the fact that, yes, we are trying to put together a policy that we're going to share with the government. And exactly the things that you were talking about is issues around URA targets. We all know that as our businesses are going to shrink, which they are, is a reality, we are not going to be able to provide URA the numbers that they were expecting. So probably we need to talk to the government to also lower those URA tax targets that we have. That is a reality. The other thing that we also want to talk to them about is talk to them about the interest rate, like you were mentioning. It also has to come as a reality, because a lot of us have bank loans that we will not be able to, we will struggle to finance in this particular time. So we would obviously going to ask the government and ask the bank, the central bank, to see what they could do on that. The third point that we have to secure our cash flow is also the area around the exchange rate. It is nothing that we can do about it, but I think, as all of us have noted, our exchange rate has gone sky high, and it's going to impact our goods. And I think you've mentioned it, the prices of our products are going to go up, not because we want them to, but because of the cost, like Benson has said, is going to be affected, whether it's the interest rate, whether it's going to be, the cost is going to go up. So we'd like the public to know about that. It is not that we're greedy, but we're trying to hold on to the things that you're talking about. We want to protect our employees. We want to make sure that we're still paying our employees. We want to help them when they get ill. So, you know, our costs are going to go up, and it's a reality, and we need to look at that. The other point that you mentioned, Benson, is the issue on helping the community. And as UMA, Uganda Manufacturers Association, we realize that there are a lot of, we have our Ministry of Health person. Her name is Solome. I'm also Solome, that's my other name, so Okware. So Solome is here from the Ministry of Health. She's going to talk to us about how to, COVID-19 in the workplace. But really what we've talked about is that their staff are under a lot of strain. They're under a lot of, and we really have to clap for them. Ministry of Health, please. We'd like to thank you for helping us fight this disease, maybe to prevent it. Of course, I think it's probably God that has helped us, because we're in this island and everybody else has it. So I think it only has to be God that has helped us to get to this. But nevertheless, as UMA, we realize that your staff need support, especially the people who are monitoring on the borders. And as an association, we are going to talk to our members, and some of them have actually put together a care package. We're going to put together a care package that we are going to provide to your staff to help them in this endeavor. Also, as the Uganda Manufacturers Association, our members are also going to put together support for some of the hospitals that are dealing with this pandemic. So we are going to help our community, to the point that you said, number 6, of helping community. Then you talked about how do we rejig or readjust some of our machinery to speak to our needs. We have, is that Saraya? We have somebody from Saraya. We have a lot of people here from the alcohol, and we have a lot of people from the sugar industry. So we're going to talk to them about how can we make sure that we can get more sanitizers out there for our population. We are going to talk to the steel sector. As you know, in steel, they do have a byproduct called oxygen. And as this pandemic keeps on going, you know, we hope not, but if we don't get it, but there's going to be a need for oxygen. Now, oxygen is actually a byproduct that the steel sector has. So the steel sector, we're also going to talk to them about that. The third area is the area on soap. As we all know, soap is critical and we're going to talk to our manufacturers to make smaller quantity, smaller, not the bar, but maybe smaller quantities to disperse them all over the country. So that's another thing that we're going to talk about. We're going to talk to our plastic sector. As I think the Ministry of Health knows, they need a lot of protective wear. So this is where the Buvera is going to come in to help in this particular situation. So these are some of the initiatives that we just wanted to talk about broadly, but we're going to talk about a little bit deeper to respond to some of the things that KPMG have been able to highlight. So I just wanted to mention that, and I'd like to thank you and thank everybody who's here for coming. So Edie? So I'll now hand it over to the Ministry of Health to give us a talk on mitigating COVID-19 at the workplace. And this document from KPMG is going to be made available to all our members, paid up members of Uganda Manufacturers Association. Thank you, KPMG.
Good morning. My name is Dr. Solome Okware. I work with the Ministry of Health. I bring you greetings from the Commissioner in charge of Public Health Emergencies. Unfortunately, he could not make it due to policy discussion that had to continue. I hope that I'll be able to deliver the information that I was assigned to, and that I'll be able to answer the questions that you have. Okay. All right. I'm going to generally go over this COVID situation. I'll give a background, present more of a clinical approach to what we're talking about, and then have a session of questions and answers that I hope that I can respond to different questions that you have. Okay. I think we all know that at the end of December, a few cases of what looked like a strange disease was discovered in China. And by the end of January, the World Health Organization had announced that there was something called a public health emergency of international concern. For many people, this was the first time they had heard about this. What exactly is a public health emergency of international concern? But it is the kind of emergency that does not only affect the country where it's originated, but begins to affect other countries. And by March 2020, the World Health Organization had declared it a pandemic. Now, the difference between the public health emergency of international concern and the pandemic is that in one, you still have a few cases littered all over the place. So your strategy is you're going to contain it where it is, you're going to prevent it from spreading, and that you're going to try and minimize losses. Okay? When you have a pandemic, what it means is basically everyone is at risk, and there are more countries affected than there are that are not affected, which is where we are now. As she already mentioned, we are in what looks like an island. And we also believe that it is by the grace of God that we are in that island. Okay? If you look carefully, This map highlights where the outbreak is. You see that it started in China, it's affected Europe greatly, it's affected the Americas, and what that means for us, as was already highlighted, was the fact that the people that are trading with us are cut off, or their priorities have shifted. Our sources of goods have also shifted. I know that there are ships that had been docked at Mombasa for several weeks, and they would not allow them to enter the port simply because they were afraid that they would be bringing the COVID into Kenya. And I know that we have all been affected by this. The prices on the market have gone up, as you already rightly put, and they continue to go up. As Ministry of Health, what we are aiming at is how do we maintain this island that we have, or should it shift to something else? How do we mitigate so that we have as few casualties of this as possible? Okay. I'll give a general overview of what corona is, a wide variety of viruses that usually cause a common cold. But once in a while, you have a new one that emerges, usually from an animal that skips to a human, and then you have an outbreak. In the past 20 years, we've had two such outbreaks. One was in 2002, and that was SARS, and another was in 2012, which luckily was restricted to the Middle East. In both those outbreaks, if you looked at the economic loss that those countries suffered during that time, it was astronomical. Luckily, during SARS, it was mainly affecting China and parts of Northern America, but still, that is a huge implication. And it's an implication for many reasons, because even in the health sphere, we are starting to see that affect us. China is one of the biggest producers of personal protective equipment used in the health industry. Okay? It also means that globally we are starting to see a shortage, we are starting to see prices that are going up. And as manufacturers, this, as she mentioned, that this is an opportunity for us to step up and see how we can fit into that space. I was at a meeting yesterday and everyone said that we keep talking about the negative that is coming out of corona, and it's about time that we start looking at what are the opportunities that this pandemic has brought us. And I believe that production of medical equipment within the country is one such opportunity. Okay, I'll speak generally about how it's transmitted. This is mainly droplets and contact. I see you already applying many of the measures that we've spoken about. Okay, keeping a 1 meter distance, okay? And that is because you're avoiding the droplets which are spread when someone coughs or contact with surfaces. Okay. The incubation period is 2 to 14 days. What that means is that even when you come in contact with someone who has the disease, there's no way for us to clearly say that you're fine until the 14-day period has ended. That has resulted in the Ministry of Health instituting self-quarantine and institutional quarantine just to make sure that the population is safe. This continues to talk about the transmission. These are the symptoms: headache, cough, muscle pains, usually starting with a fever, and bringing us to something that we call a case definition, which is how we find individuals that are most at risk of having this disease. These are the people that will have the symptoms and a link to a country where you have transmission, which is why the Ministry of Health has issued an advisory that has countries in 3 categories. The category 1, countries that have active transmission right now. Category 2, that we are watching, and category 3 are the countries that have no transmission. Unfortunately, category 3 keeps shrinking, and Uganda is one of the very few countries that are still in it. Diagnostics, this is mainly by something called a PCR from a sample taken from the back of the throat. As I mentioned, the symptoms start with a cough, a fever, and the best place to get a sample to test is at the back of the throat. I will speak about the management strategy that we have right now, which is controlling at source. Many of the measures that the Ministry of Health has put in place are targeted towards this strategy, control at source. You have seen the numbers that are multiplying in other countries. For instance, Italy is recording record numbers, almost 1,000 cases per day, along with quite a number of deaths that are accompanying that. And those numbers equate to hospital beds, they equate to employees, they equate to our loved ones, and they equate to our community members. Those numbers are astronomical. If we had 1,000 cases per day in our setting, we would fill our hospitals, and it would also mean that all your employees would not come into work because they're all sick. And that is why our strategy is, how do you contain at source? It has a few arms. One is detect, and that's early detection. That focuses mainly on making sure that anyone who has symptoms is identified early, is put in a location that separates them from others, so a designated space of isolation, and the sample is taken off from them so that we can have diagnostics in a very, very short time. And the diagnostics are done at the Uganda Virus Research Institute. This ensures that we do not get to a stage where we have community transmission, which will simply overwhelm all our systems. Then we also have prevent, which targets mainly at the community level. How do we interrupt transmission should we have cases in Uganda? How do we make sure that nothing is moving from one individual to the next or within a family? And that's where those measures are targeted. Finally, we have respond, which speaks of aggressive supportive care. I say aggressive supportive care because currently there is no clear treatment for COVID. There is no clear treatment and there is no vaccine. And if we have an understanding of that fact, it will also help us understand the I don't call them severe measures, but the level of measures that have been put in place. We have quite a number of people at risk. Okay, it's a new disease. No one has ever had it, so we don't have any immunity in the country. Okay, but also what it means is that those who have comorbid conditions, that means someone who has diabetes, someone who has high pressure, particularly those that are uncontrolled with our health-seeking behavior, okay, where we are not necessarily the most active when it comes to keeping ourselves healthy. Perhaps we should look at this as an opportunity to rethink that and make sure that we focus on our health just in a daily life. And all this is supported by something called infection prevention and control. I'll go into infection prevention and control a little bit because it will help you understand the measures that were read out by His Excellency on 2 days ago. So it's a discipline that aims to prevent or control spread of infections in a healthcare setting or in the community. It's aimed at protecting yourself, your community, and patients. In this particular case, yourself and the community. It's very important that you realize that the first goal is to protect yourself. Many times we think about how do we maintain our business functioning, how do we maintain our staff, and this is the way that we are thinking. But at the beginning of everything, we need to think about how do we protect ourselves and make sure that our families are not at risk. And this will lead us to protecting our our communities. There are a few principles that I saw that you're already applying. The first is having triage. So as I was entering here, there is a desk that is taking temperature. Okay. You are ensuring that if I have a cough or cold, you ask me not to enter, and you put me separated away from where the others are so that I don't have a chance to infect. All these measures are very, very important, and that is part of infection prevention and control. Then applying standard precautions, I will speak of two from that, and then droplet and administrative controls. So triage is the process of simply sorting. I know that you know about this. How do you find what is good, and how do you find what is problematic? And separate out that which is problematic so that it does not affect the rest. Sort of like one bad tomato will spoil all the rest. That is the same principle. Okay? It also requires for us to have a high index of suspicion. As I was walking in, I noticed that the gentleman who is screening us is wearing a mask. Okay? That means he has assumed all of you have something that you're going to transmit to him. And that is the kind of mentality that we have to have in this season. Not to paranoia, okay, because we also need to maintain calm. The second that we start panicking, we are going to make mistakes. The second that you start panicking, you will definitely be in trouble. So a level head, but a level of suspicion, okay? A level of caution. How do I make sure that I am safe? How do I make sure that my employees are safe? How do I make sure that when I allow an employee into the factory, I am not simply creating a center that will spread? I think we all read about what happened in South Korea about a month ago. One employee entered the Samsung factory and managed to infect quite a number of his workmates. That is something that we do not want here, because the reputational risk that will follow from that infection might not be worth the goods that you're producing. So these are all things that we need to balance, okay? Especially for employees that are paid per day. It's very common in the manufacturing industry. Employees that are paid per day, helping them understand that this is not penalizing them, but this is simply helping them to get better and helping the rest of the workers to be safe. That is very, very important. Providing them with that kind of psychological support that during this entire time, they understand that this is for their good. This is a time when the human resource area of the industry is going to be on overload. People are going to be stressed. People are going to be overworked or underworked, and therefore they will be stressed even more. And therefore there is need to provide that psychological support and psychological support system in this case. Okay. You recognize ill persons and ask them to work at home. You notify the authorities. He spoke about teleconferencing and working from home. How do we support each other to make sure that we can do this? Okay. We commend MTN for what they're doing with their reduced data packages. How can the rest of us join that boat? Okay. Then these are just the standard precautions and the travel advisory. I will leave all these slides so that we can see which countries are affected and how we can keep ourselves safe. Okay. Then there are administrative controls. South Africa, yes, sorry, this is not included. South Africa is on number 1. They have quite a bit of community transmission, and countries that have community transmission, countries that have an exponential rise in their numbers overnight, we are putting all of them in the category 1. Again, this is not to penalize anyone, but just to make sure that we are safe. We don't want exponential spread within Uganda, we have very many communities that live quite close together. In the high population density areas, okay? We have one quite close here, the Naguru go down. We have another quite close to Mbuya. Those are places that if you had even one case, so each case of corona transmits to on average 2 to 3. So if you had even one case in those kind of areas, those high volume areas, it would result in a disaster. Okay, so we try and maintain how do we keep our borders as safe as possible and how do we keep our people safe. He's already spoken about some administration controls. Make sure that you develop contingency plans and institutional policy. Okay, no one should enter unless they've washed their hands, so that we also transmit this into something that people are doing at home. And your contingency planning should cover all the different categories that he spoke about. In health, we are looking at what do we do when there is no case? What do we do when there are few cases? And what do we do when we have that massive outbreak that is just in the entire country? So make sure you target for all those three. Then you designate isolation spaces. Okay, so in your workplace, as I'm entering, if I find that someone has a high fever, we have an outbreak, someone has a high fever, they are coughing, where do you put them? Do you simply say, go back home, the person jumps back onto a taxi and goes home? What exactly is the plan? Do we say that they enter the room and sit at the back? So in each of your workplaces, these are very important things that you have to think about. At the entrance, I'm identified as having symptoms. How do you put me safely away from everyone else, but not in a way that stigmatizes, so that now I'm psychologically traumatized, and even after this, I can't come back to work, okay? But at the same time, keeps everyone safe. How do you make sure that you give someone a 2-meter radius around them, but you're maintaining some form of dignity? Okay, these are important things to think about. Then provision of adequate supplies. Make sure that the people in your employ have hand washing facilities. We've spoken about alcohol. In places where it's completely not available, just provide the water and soap. And how do you make it policy to ensure that everyone is actually washing their hands? There's so many things that are prevented by washing hands. Yesterday I was in a meeting and someone said that if we simply wash our hands, we will control for 70% of the reasons why we show up at the hospital. So there are additional advantages. Focus on those. Make it a habit that now everyone is washing their hands. Then you establish a surveillance system among your workers. This is health workers, but also among your workers. Okay? Identify who fell sick, who are the people closest to them, okay? And how can we support them in this process? Then you make sure that you monitor compliance to the measures that you have put in place. Make sure that everyone coming in is adhering, okay? I put this in there just to show you how to hand wash and hand rub. So often our hand washing is I will say lacking. Okay? Before we eat, we wash the tips of our fingers and stop there. Okay? Or when we are entering here, we put on a very little amount of alcohol to wet our hands, and that is it. Good hand washing takes at least 20 seconds. Anything less than that, you're washing your hands in your mind. And these are important things we need to learn, and these are important things that we need to teach to children, okay? Particularly during this time as schools are closed, how can we support our children at home to learn these important things? That they're not just washing their hands because of corona, but they're washing their hands because it's a good practice and will have long-lasting effect, okay? Then cough etiquette. This is also very important. How do you cough and make sure that you're not spreading the infection everywhere? How do you make sure that you're not coughing, then going ahead to shake hands? How do you make sure that you're not coughing then touching the doorknobs? As you touch the doorknobs, you're spreading the infection to everyone who is coming after you. All right? Then these are personal protective equipment. This is usually something we go through with health workers, but I felt that it's something important that we need to go through. Over the last 3 weeks, we've been seeing more and more people walking around with masks. Okay? It has completely thrown the market off. For instance, face mask, the first one. Okay? About maybe 4 months ago, prior to the outbreak, you could get a mask between 500 shillings and 1,000 shillings. Now to get one, it's close to 10,000 shillings. Okay? We are buying unnecessary things to protect ourselves and yet putting ourselves still at risk. Okay? The masks, the first one, the face mask that I think you've seen many people walking around with, is important if you have symptoms. If you're coughing, you have flu, and you don't want to transmit, please wear the mask. The second one, the N95, it's usually used more in industry, okay, and in healthcare working setting. It prevents particles from entering and therefore affecting you. It's important for us not to buy unnecessary items. We are throwing off the market. We are making them unavailable for those who actually require them. Okay? And we are putting ourselves at risk. If a mask is 10,000 shillings and you need one, let me see, if you're stretching it, you need one every maybe 2-3 hours, no one is going to buy that many masks. So you're wearing one the whole day. By the end of the day, yesterday I saw quite a number, and the front of the mask is completely brown. You're just giving yourself a chance of getting infected. Second, because it's really dirty, you're putting yourself at risk not just of corona, but also other sanitary connected diseases. So please, please, please don't buy a mask, don't use a mask unless you have symptoms and you're trying to protect others. Having said that, if you know that you're in the business of selling masks, please don't hoard them. The hoarding is causing some artificial absence of masks that's driving up the cost. And therefore, even the health workers that would require them are not getting access. Okay, so those are very important things that we should think about. This is a summary of what it is. Please maintain the 1 meter distance. Apply cough etiquette. Perform hand hygiene. Use the mask only when you must. Okay, then decontaminate surfaces and use those administrative controls. Those are very, very important. As leadership, you need to decide how you're going to protect your employees from getting corona. He spoke about the financial part of your contingency planning. Please make sure that there is a health aspect to your contingency planning. I will finish with the do's and don'ts from the Ministry of Health. 1, avoid shaking hands and hugging. Avoid close contacts. Please don't come to work when you have flu-like symptoms. Okay? Wear a medical mask only if you have symptoms. Don't self-medicate with antibiotics. Okay, it's a viral disease, unless they've been indicated by a healthcare provider. Do not spit in public. Delay travel to those COVID-19 countries, and just avoid travel to those countries. If you can, defer your travel. Either way, when you go there, you will find them also on lockdown. Okay. Then, yes, avoid travel if you have flu-like symptoms. If you're under home isolation, stay in a well-ventilated room. Okay, stay at home for the duration of the 14 days. Ensure you have adequate food, water, and hygiene provisions. Always wash your hands. Cover your nose and mouth with a handkerchief as you sneeze or cough. clean and disinfect surfaces and doorknobs, disinfect bathrooms, and if you develop symptoms, communicate to the Ministry of Health immediately. Okay? Then these are additional measures for the workplace. One, mount alcohol dispensers at strategic points, so at the entrance or at doors and things like that, and take your employees through these hand hygiene practices. Don't just put them there and say, I did my part. Okay, but actually train on these activities. Advise sick employees and clients to stay home. That might be difficult, but please advise it. Then have screening procedures at the entrance. Make sure you have hand hygiene provisions. Minimize hand security checks. So these pat downs where someone has to come into your face, please try and minimize those. Modify operational structures to encourage social distancing. Make sure you have hand hygiene provisions at points of payment or at ATMs, and encourage contactless marketing. Okay? So do more of e-marketing. This is the chance for us to really build that field. Then these are the contacts at Ministry of Health, the Public Health Emergency Operating Center. It runs 24 hours a day, so in case of anything, please call. They're toll-free numbers, so this can be given to your employees as well. Then you can text 6767 and you begin the message with alert, then your message. Please try and be clear, specific, and not all over the place. Okay? We receive all kinds of calls. We receive calls asking us about bringing in technical support from Category 1 countries. We receive calls from individuals thinking they have symptoms and therefore they have corona. We receive all forms of calls. So in case of anything, please do not hesitate to ask. Okay? Or you can contact the Incident Commander at Ministry of Health, Atek Kajirita, or the Commissioner in charge of Public Health Emergencies on that number. Thank you very much.
Thank you so much, Dr. Solome. I guess, to me, the takeaway is I hope that we keep the same protocol even after COVID, because I think it can help us on a lot of illnesses. I'll now hand it over to the ED for some Q&A. And
I think our speakers deserve another hand clap. I think they've done well. We'll now take some questions, both from the first presentation and the second presentations. I know that we have some questions that have arisen from our online audience, and we shall also be referring to those. But we'll start with the members in here. If you have any question that you feel hasn't, in an area you feel hasn't been explained particularly well for you, this would be a good time for you to ask it. Okay, we shall have one there, and one there. Let's start with the lady. Do you need a microphone? Good.
Morning, everybody. Mine are really just seeking clarification, I think, from Ministry of Health and maybe from the chairperson. I work for Uganda Healthcare Federation. I'm the executive director. We're the umbrella body for the private health sector. And some of the challenges we're facing have been touched upon in terms of hiking and hoarding of prices. Ministry mentioned we're having a challenge because we have to remember we're not just managing avoiding corona. We're dealing with TB, HIV, malaria, other communicable diseases that were already in the country. So when we face hiked prices for protection equipment, it actually affects our ability to continue to provide care. So we wanted to explore maybe from the manufacturers who is able to produce a lot of this protective equipment in a short period of time to help us manage the hiked prices. And also, how can we also look at managing the distribution and outlets that are hoarding and hiking? If there's any kind of support we can get from that perspective in terms of recommended retail pricing and so forth, so that we're able to continue to provide service at an affordable price, because as our inputs go up in price, service delivery goes up in price, which means consumers can't afford health, and we're already facing that challenge. Thank you.
Thank you very much. There was another question there.
First of all, I want to thank my chairman taking the lead and holding this meeting and giving sensitization through KPMG and the Ministry of Health. This is really useful. I appreciate you. Mine is many questions, but one or two I can raise this one. How, first of all, how do we establish somebody with COVID? Only the symptoms, or you have any testing procedure to see that whether we have any test kits available? So if so, as I'm representing pharmaceutical company, so I can able to secure them and able to provide to the health facilities at a very faster time. So that's need a clarification. Just isolation itself will help them to relieve, or you have any specific medication also is needed. So we also have a huge distribution house, pharmaceutical, so I can hold the stocks, especially cough related, cold related and fever. All those things we have readily available. We assure you we can make it available in a short notice. Paracetamol, even in the form of a liquid, that's IV fluid, paracetamol IV fluid, and also any other dextrose, normal saline IV fluids is easily available with us. So we are ready to support for that one. But we need to, for our workers, if somebody coughing, cold or something, so how do we test them and see that whether it's a normal cold cough or is a COVID-19? So that's very, very important for all the people to establish. Otherwise, assuming them that is a COVID is dangerous. Second thing is, you mentioned the category countries. So I've seen that there is no category of India in the first category. But there are several people, yesterday my staff also came, they've been taken and quarantined, saying that India is a category 1. So I'm really surprised. So India, as per this thing, WHO is a category 3. So how is that quick decision been made and done it? As of today, still is a category 3. So some of my employees are still there, and several of other people coming from India have been standard there. So I just need some clarification on that side.
Okay, thank you very much, Mr. Ramesh. Move on to the next person. Just yes. Okay. We'll do better. Please, if you can, don't use the microphone. We're being advised you could get contaminated. Can you speak without it? Okay, fine. Go ahead. Go
Okay,
ahead.
good morning.
Just keep the microphone a bit far from your
Yeah,
face.
my name is Ronald. I'm from Bidco Ginger. I just have two questions, one for the ministry and one to our chairman. As a country, doctor, do we have enough test kits for testing, and if they are available, where are they, and where are the centers where these tests can be done? Then to the chairman, among us in our stakeholders and our partners, we have companies that are producing these sanitizers. Is there a plan of engaging them so that they can produce, and we can get in touch with them as manufacturers who have people and employees working with us? And lastly is that the basis of selection of the categories of these countries, I think it's the same question my brother here has. What basis are we looking at? I might have employees who are planning to fly over and come to Uganda, so I need to understand the basis of the selection of these countries. What do I look at? Thank you.
Okay, thank you very much, Ronald. Perhaps just an announcement. I think there was a scare earlier in the morning about a patient who had been admitted to IHK. We've just received confirmation that that patient has tested negative for COVID-19. So Uganda is still at 0, category 3. So kudos to the Minister of Health. Perhaps in addition to Ronald's question, you would also add, for the benefit of the team here and everyone watching us online, what are the measures in place for people coming from these countries when they arrive at Entebbe? because there could be some that are already en route that probably the companies are bringing in, and they will need guidance on how to treat such situations. Let's answer the 3 questions and then we'll take another set. Chairman, you start.
Okay. Sorry. Once again, I'll repeat. Manufacturers do not want to take advantage of this particular situation to raise prices. That is not our intention. And actually, we, as the KPMG has mentioned, our costs, a lot of our costs have gone up, either exchange rate or the supply chain. There are a lot of costs that have gone up that are causing some manufacturers to raise their prices. But what we are going to talk about as a manufacturer, as Uganda Manufacturers Association, is to make sure that that is what they have increased the prices, and it's not advantage that they're taking care of. Your question was what? Sorry, I forgot. What was your question? You said you had one question. Oh, yes. I think you might have come a little bit later. We do have Soraya here. We do have the sugar industry here. So we are going to engage with them. We have the the alcohol brewers. We're also going to talk to them with regard to that. I'm going to help my sister, or my daughter. I don't know. It's a daughter of a granddaughter. I don't know what it is. I'm going to help Dr. Solome with regard to the issue of not hoarding, but really the issue on people coming into the country and this whole quarantine. Quarantine is something we need to do. What I have actually been at the airport myself and have witnessed people who are refusing to quarantine. Our country, we have to be very clear, does not have the money to pay for all of us, because if it did, then we will take the money away from Ministry of Health, who need to help our brothers in these various slums or highly densely populated areas that she was talking about. They need to get that money, so they do not have the money to quarantine anybody who comes in country. So I think as part of our CSR, this is something that we need to accept, that we're going to have to pay. It is hitting all of us. It is very expensive. I myself have been hit. I've got 2 children who have now quarantined in a hotel designated, which I had not planned in my own budget. But I am having to abide by it. So please abide by it. That's what I will ask all our members, because a lot of our members have either people who are coming in to install machinery. I think you have to be cognizant of that. If somebody is going to come in to install any machinery, they're going to have to stay in, they're going to have to be quarantined for 14 days. It's a cost to us. So these are all the costs that we are having to incur. So we're having to install equipment, but the people have to come in and 14 days that we have to pay for, which is a cost, come in and install and then go back, and then they're going to be quarantined when the country is in place. So please, I think the only thing that we need a clarity on are the countries, because even Kenya is not there. So if you say the rest of the countries, let's just be clear. I think, but also to understand that because this is constantly changing on a day-to-day basis, a country that was not in category 1 can easily go to category 1. South Africa, I'm curious, because we have a lot of children who are coming from there, and we also do a lot of business with that. So is it now category 1? So that means that they have to be quarantined. Okay. So, yes, thank you.
Thank you very much. I think she's spoken about what happens when people come in at the airport. I'll stand so you can see me. So as individuals come in at the airport, as was communicated by His Excellency, we are doing institutional quarantine. And the reason why we are doing institutional quarantine is to maintain our control at source policy. It's very, very important. We had been running a self-quarantine policy that when people came in, they would quarantine at their homes and things like that. But as the numbers are going up, it's very, very important for us to track where everyone is, and this will aid us in tracking. Okay? The basis of the Category 1 countries, I'm sorry that this was not updated to what it is today. So basis of Category 1 countries is the countries that A, have very many cases in the days previous. So that is a sign that there is active community transmission in those countries. Okay, so it means that just by walking through the streets, by shaking hands, by eating somewhere in those countries, there's a chance that you might have been infected. Secondly, it's the countries that have a huge number of cases. I'll give you an example of Italy. Right now, Italy has 40,000 cases in one country. That just means that the chances of someone coming in from Italy with the corona infection is higher. Okay? And thirdly, if there's an exponential increase, so you went from 1 case to 400 to 1,000 over a very short period of time, a few days, that also puts that country into Category 1, and that's how the others got in recently. 1. Another thing that you have to notice, even transiting through one of these countries would put you in Category 1. Okay? You asked about test kits. I will combine that with a question about diagnostics, and the gentleman has stepped out briefly. In order for us to do testing for COVID, we need to have what is called a case definition. I put it up a while back. A case definition in the medical field is a group of characteristics a person has that enables us to narrow down what you could possibly have. In this particular case, what we have is the symptoms of COVID, so the cough, the flu, the fever, plus a link to a country where there is active transmission. Right now, we do not have transmission in Uganda. So we must establish that link to a country where there is transmission, or a link. So if I came in from South Sudan, for instance, where there is no case, okay, and I was coughing, that is a different presentation from someone who flew in from, say, somewhere in America where there is active transmission, and then now I have a cough. So the individuals that have those symptoms plus a link to a place where there is active transmission are what we would call a suspect case. Okay, and those are the ones being tested. The testing is currently being done at the Uganda Virus Research Institute in Entebbe. When you're doing testing for different viruses or bacteria, there are different categories of labs that are able to test. Not just looking at the reagents, but even the safety within the lab. So it ranges from what is called a biosafety level 1 lab, which can basically be this table. I bring a malaria kit, I put it here, and I test you for malaria. We are all safe. All the way to what is called a biosafety level 4 lab, where you have to put in place certain stringent measures of safety so that those who are working inside that lab do not get infected. So right now, where we are testing at the Uganda Virus Research Institute is the last category, the biosafety level 4 lab, okay, where there are specific measures in place that can do that testing. So when you call any of those numbers, we will assess the requirement for a test. Someone from the lab will come to you. I keep insisting on it. Someone will come to you. Please don't put someone in a taxi if you think that they have COVID. You're putting everyone else in the taxi at risk, and tracing all of them will be a little bit of a challenge. Okay? call the numbers, we will come to you, take off a sample, identify a space for you to be isolated, and then the tests will be run. Yes. Yes, I think we answered the question of how we differentiate. So those symptoms plus having a link to where those cases are coming from. Yes, I think I've answered majority of the questions.
Okay, I'll just take a moment to read through some of the questions that our online audience has sent through. Someone was asking about medication, which you've ably answered, I believe. We also had a question about, this is also about medication. What are the proven drugs? And I think we've agreed that there is no drug yet to cure, but what is being handled is alleviating the symptoms. I think that has already been clearly explained. Someone is also asking, this is Julio is asking, when should they exclude visitors from the workplace? Is that one of the protocols, and when should it happen? Perhaps you'll answer that. Then we also have a question around the cost of sanitizer from a Philip Taga, and is asking what UMA can do to help lower the price. And I think the chairman has ably explained that by saying we're engaging our people who produce ethanol to see how we can raise the stock of sanitizer in the country. But beyond that, I think the advice we can give, and the Minister of Health has been quick to give this, is that soap and water are the most effective, are the first line. And these are in your neighborhood shops, these are in your homes. Let's continually wash our hands with soap and water for at least 20 seconds at a time, because that is the surefire way, one of the first ways we can get to address this. We have Cuthbert Singoma from O'Shea Institute, who has just indicated that yes, he's watching and he's glad that this is being done. We have Mugasha Joseph, who is also acknowledging that he's online, and a couple of others. We'll keep reading through them as they come in. The lady over there had a question. Do we have any others? I think we'll take only 2 more questions, and then we'll close this. You can get the lady a microphone so that she can ask. Give her this one.
Good afternoon, ladies and gentlemen. Okay, mine, first of all, I would like to appreciate Uganda Manufacturers Association for this effort. Whereas we sit in the contingency plan meetings to understand what we should do, it doesn't get to closure because you don't know what to do. But I'm glad that there is a policy in place that you're trying to pursue to answer some of these questions, because in the end we are being affected. However, my issue is about, it is almost similar. I'm not trying to be verbose, but I want to really understand. I am dealing with very many employees. And what if I measure the temperatures and they are high, and maybe there are symptoms of cough? You have said we get somewhere that we can quarantine these people, and we call this number. What is the response time? Because the moment that I segregate this person, there is going to be cause for something which we are trying to guard against. If I have to take this person, I need to take them away, at least in the shortest period of time, such that they are declared free and they go. So I want to know the effort. Is it wise if I have a nearest health center, I can take this person there? Is it wise? And are these people in the health centers actually aware of the procedure? Because some of them, you will find them chasing. I have friends in the UK who have been affected. They have been quarantined in their houses. Don't get out until after 14 days. That's when we will respond to you. That is the medical. You get it. But here, you're saying you will come and take them. What is the response time? Thank you.
Thank you. Aisha Nakasuja is my name. I'm the CEO of Aloisha Organic. We manufacture organic natural health products. We appreciate you, Oma, for this event. Thank you so much. We really need it. And true, the prices are hiking, let's say for packaging and everything. So as we people who are dealing in organic manufacturing, we are also being affected by the packaging and other things that we need. So thank you.
Good afternoon, everyone. My appreciation to Uma for organizing this session. Very grateful. My question is, I would say there are two. I haven't seen billboards around as a way of sensitizing people. I'm not so much sensitized on billboards, but the kind of awareness that I would expect would be more stronger than what it is. I have relatives in Fort Portal that have been trying to find out about the coronavirus, and people are like, no, we don't know about this. So, question is, are there measures from the Ministry of Health, from the grassroots level, say like from LC1, going downwards or going upwards, measures that are put to sensitize people about coronavirus? 1, 2, I've been seeing this notice going around about rent payment by the president has said they're going to suspend rent payments from tenants. Maybe I could have a clue about it too. More educate people about this, because some of these things we take them lightly and yet maybe they mean something. Thank you very much.
Okay. I will answer the question in response time first. The Emergency Operations Center, the Public Health Emergency Operations Center, is situated in Wandege, next to Ministry of Health. Okay. And the response time is kind of determined by your radius around that. As long as you're within a 10-kilometer radius, we should get to you relatively quickly. An hour, 2 at the most, but we should be with you. The concern about taking someone to the nearest health center is how you will transport them there, or if you'll give them a mask in order to transport them there. So we are concerned about your method of transportation. But if you can assure that you will provide the person with a mask so that they are protecting those around them, then you can take them to the nearest health center and they will take care of them. I understand your concern with keeping someone segregated at the workplace. It can be quite stigmatizing and will be difficult to deal with later on. The billboards I will take not as a question, but as a comment. The Ministry of Health has a risk communications and community engagement plan just for COVID that is responsible for engaging with community, educating and helping them understand their role and how they will be affected by this disease. I will take your comment on billboards and your relatives in Fort Portal not knowing, as we will strengthen that arm, not really as a question, but as a comment. Okay.
Some of the expenses were now incurred. Uma is going to have to buy a box of tissues every meeting. Like I said, there are quite a few initiatives that are taking place. One of the things that we had said as manufacturers is that if you have any ads advertisement, if you have any in Facebook, Twitter, marketing plan, if you can please assign some space on that and send it to the population, because that's what's going to help. If all of us as manufacturers use that, I'm looking at my brother from Bidco, if we can use any of your advertising budget to maybe put some information on that, wherever, everybody, that's what we had said that we would do. Now, also, we're also running a lot of these ads in these various languages. Like I said, they don't have the budget. But if we have, let's say, Radio West, and we have some allocated time on Radio West, or wherever it is, if we can please take some time off and give that as a message to all our relatives in Masiriba and all that. With regard to that issue on rent, that was actually fake news, and I think Benson mentioned it. There is a lot of false information that's out there. There's a lot of information out there. A lot of it is wrong and false, and that's why it was important for us to have this and to get the Ministry of Health to come and tell us that has actually not true. He has not signed that, and if you look at that signature, it's not his signature.
Thank you, Chairman. Perhaps just a couple of things I wanted to rehash. One is also on the part of you as manufacturers at your factories, but even at your homes. We've received news of unscrupulous people using this opportunity to go to neighborhoods and say they are coming from the Ministry of Health and are coming to sanitize your home. So it's important that you do not let these people in. If you have any queries about people who are approaching your factories, reach out to the Uganda Manufacturers Association. We have a direct link to the Ministry of Health, and we will be able to advise on whether these people should be let into your factories or not. Then the other one is also on this presentation. We had a question about whether this is available online. Yes, this entire session is available online on our web page, but it's also going to be uploaded to our YouTube channel so that you can go and refresh yourself on some of the issues that have been raised here. Then we shall also be sharing the documentation, the presentations from both KPMG and the Ministry of Health on our media channels for you and for your staff to be mindful of that. And then finally, as the UMA, we're also working closely with the Ministry of Health to come up with standard operating procedures for COVID in factories and in manufacturing entities, which we shall be sharing with you. And we're also coming up with media materials in terms of posters that you can put up within your factories. If you're interested in any of these, reach out to the membership team, and they'll be able to get them to you. The membership team can be reached at membership@uma.or.ug. I hope that's it. Yes, membership@uma.or.ug. Otherwise, we wish to thank you so much, both our audience here and our online audience, for giving us the time. And at this juncture, we wish to close this session that was about COVID-19. For those of you who are here from the sectors that we've mentioned that are doing sanitary items or things that could assist, please stay behind. We have a short 30 minutes meeting where we shall talk about some of those issues. Otherwise, thank you so much, and thanks to the ministry, thanks to KPMG. Have a good Friday and a good weekend, and stay safe.